Hello everyone, welcome back to the YouTube channel, welcome back to another episode. My name's Dr. Alex George. For those that are new to the channel, I make health content on here. I also make some videos on properties and also interest in cars. So today I'm actually sat in my car. I'm about to go into A&E today, and I was hoping to bring you guys a bit of an update about what we're seeing on the front line, a bit of an insight really into the pressures that we're facing. Obviously you guys are seeing the figures on the news, the number of deaths. When I've recorded this today, I believe we are now at around 1,600 deaths per day, which is awful. It's a real, it's a tragedy. And it is really sad. To be honest, driving to work, I've been a bit emotional today. I think a few things. I've missed my brother quite a lot, and I've been thinking about how tough this pandemic has been. So I've been a bit emotional. Sorry if I'm a bit, red-eyed, etc. But it's only natural, and it's part of what we're dealing with at the moment. And I want to be honest with you guys. When I'm feeling good, and when I'm sad. So yeah, I'm just missing my brother a lot at the moment. This video is going to be hopefully a very honest video. I'm going to share with you guys what we're kind of seeing, give you guys a bit of a feel for what's happening. Obviously I have to be very careful with patient confidentiality and privacy and stuff like that. That's obviously paramount, and I always film with the permission of the hospital trust. So yeah, we're going to go in and have a chat in a moment. Before we start this episode, I want to tell you a little bit about something. You guys have seen me talking about Lifebuoy before. I want to show you a product which I think is quite handy. I was not driving to work and I thought I'm going to show these guys this. I have got these hand wipes, hygiene hand wipes, which you can use to actually clean your phone amongst other things, which is kind of handy because actually, if you look online, just do a quick Google, you will see how dirty, I'm not going to make comparisons, but how dirty your phone actually is. If you think about when you use your phone, what you're doing when you're using your phone, and what you're doing just before you use your phone, it makes sense that it's quite dirty. These are hand wipes that basically will clean that, works against bacteria and viruses as well. I'll show you the pack. I actually keep these on my side door, so if you jump in the car, you need to clean the phone, bam, they're there. It's a small little pack, easier to take around, and yeah, it's just nice to know that your phone isn't filthy. One thing I would say is just double check, obviously, that your phone, the manufacturer says that you can clean it using wipes. Most phones you can. As you can see, I'm in the old Mini today, but look, it's so easy, just whap. There you go, lovely, good wipe all over. You feel a bit happier. You've cleaned off any bits and bobs in there. Get rid of your finished wipe, and you're done. Right, let's get today started and go. You can wave. Good teamwork. Back to the march. Right guys, I've taken a few moments from my shift. I just want to have a chat quickly with Dr. Rebecca Crawford, who's one of the consultants here and has been kind of leading the team throughout the pandemic. And I just Rebecca, thank you for your time first of all. Obviously, we're running around pretty crazy here. How have things been for you kind of leading the department? Because I've talked on the channel before about the pressures and stuff. It's hard enough being a junior doctor. What's it like being a consultant throughout this?
It's been incredibly difficult. Certainly since Christmas time, it's really picked up. The numbers coming into the department have not kind of equalled the numbers leaving the department, which means we've been absolutely chock-a-block trying to then manage very unwell patients that are coming in, and trying to work out where we can put patients, where we can see patients, how we can manage our resources, manage our doctors. And it's just been absolutely relentless.
It's going to put a lot of pressure on us. I think one of the things I was saying before is, in the first wave, it was almost like the adrenaline was running off, isn't it? It's like, right, come on, we can do this, let's get through it, and keep kind of pushing and rely on that kind of feeling of like the public behind us, etc. But this time round, everyone's quite tired. It's been a year now or more, and we're all kind of running out of that energy, really, isn't it, in some sense? I think you can see it on the kind of front line with the staff. Everyone's feeling quite tired and fatigued. I'd say morale is still okay, but some of the nurses, particularly, and some of the doctors who are spending a lot of time in the blue resus, or in the areas that we're seeing a lot of COVID, it's hard on them, isn't it, really?
Yeah. I think because obviously we're now 10 months in to this pandemic, obviously things got a little better over the summer months, but with the pick up over the last few weeks, and it's been prolonged. It's not just been 1 or 2 bad days. We're all used to having a few bad days, but this has been day after day of
just relentless.
Yes.
So I think some of the things I've seen some people talking online saying, well, winter pressures, it's always busy in A&E. Yes, it is, but this is something like we've never seen before.
I've been a doctor for 16 years, and I've never ever experienced anything like this. I'm used to seeing kind of patients in corridors in winter months, and that's always
We do
awful.
see that, sadly. It's awful, but we do see it. That's the reality. Yeah.
But this is something else. This isn't like something I have not experienced before.
And it's really sad to see, it's awful, because the thing is, we're all doing our best for the patients, but ultimately there's a limited number of space, we've got a limited capacity, we've got a limited number of doctors and nurses. We can't magic that out of thin air. You know, like we can't magic, because we're all doing our best. And I think I found myself hard sometimes when you feel like, wow, this is borderline getting to the point where we can't take anymore, and you don't want to see a situation where, you know, at one point, you know, the other week we had patients queuing up in the ambulances, you know, people waiting in the ambulances to come in, and that's something that's happening around the country. That's not just here, that's everywhere. But no one wants to see that. We don't want to see that.
No. So, kind of, I feel at times very responsible when I know that I've got 5 ambulances sitting outside waiting to come in. I've got nowhere to put them. I'm desperate to bring patients in and manage patients how I would like to manage them.
So, a nurse at Royal London who said that they're managing 4 patients per intensive care nurse. Just to give you an idea, it should be 1-to-1, shouldn't it? But we're experiencing that in here as well, aren't we? At times, that pressure.
Yes. So we're being stretched really thinly.
What I would say is, look, everyone's doing their best here, and I think I'm very proud to be part of the team here at Lewisham Hospital. I'm proud of all the nurses and doctors and everything they've done. But we do need, you know, people to keep doing what they're doing. You know, I think it's not about having a go at people. I think most people really are doing their best staying at home, and obviously the mental health implications of that are huge, and you know, like you guys know I really care about that, but it is important, because what we don't want is that pressure in here. And we've got Alison to the channel. She's on it before. She's got a pink haircut this time. Look, she's doing a lockdown haircut. Actually, that's not true, because before it was trimmed at the side. It was actually pink, I think, in the last video.
Maybe.
How are you doing? How is it in there at the moment?
It's okay. I've just done a chest drain very successfully, which I'm very happy about.
She's showing off now. She's done a chest drain in recess.
No, I was supervised.
You supervised, yeah. Well, I'll just say we were just talking about the pressures and stuff, and how we need people to kind of basically keep doing a bit, staying at home, and trying to keep this virus at bay, really, isn't it?
Absolutely. I mean, the more you can help yourself at home, the better, to be honest. Even with things that are not corona, like use all the channels for getting medical advice. Don't just pop up here because you'll get seen. Like, just make sure that you've tried all the things at home. For example, if you're in pain, please take some painkillers.
Do your best. But anyway, guys, thank you so much for your time. We'll get back to work and stuff, but I wanted to give you guys a bit of an insight. I'm going to go and have a chat as well a little bit later, some of the senior nurses in the department, so we get their input as well. But thanks so much, and thanks, Rebecca. Let's get back to work. Right, guys, so I am at the end of my shift. I'm absolutely knackered. I'm joined here by Amanda, who's not only one of the senior sisters in A&E, she's one of my good friends as well.
Hello.
And Amanda actually is the reason why I'm addicted to bath bombs, aren't you?
Yes.
You are.
How many bath bombs do you have a week?
I probably have like 4 or 5. We actually trade bath bombs, so we come into work, and Gail actually, who's another senior sister holding the camera, also loves the bath bombs as well. We just like to treat ourselves, bring ones in, etc. But we started it because I looked terrible afterwards, after a shift in the middle of the pandemic, and Amanda thought he needs a bath bomb, and then my addiction started from there.
Exactly. You have to treat yourself in lockdown.
You do. You have to look after yourself. And well, the reason we're chatting now is because it's been a really tough day. I really wanted to film a bit more during the day, but to be honest, it's been manic. I know I spoke to you guys earlier when I was speaking to Rebecca, one of the consultants, but it's been one of those days. Spent most of the day in resus, seeing a lot of COVID patients, admitted, some to intensive care, others to the medical wards. I think one of the things I wanted to touch on with you is that I think there's sometimes there's a misconception that the sick patients just go straight to ITU. We actually have to deal with them here in A&E first, don't we?
Yeah, there is a massive pressure within London in particularly for ITU beds. Our resus rooms are actually very, very full. We're high to capacity. So we have a COVID resus and a non-COVID resus here at Lewisham. Both resus rooms are full today, aren't they?
Yeah, they're full. They're packed. I know the majors are packed. We've got ambulances queuing for some of the bays, particularly actually in the non-COVID majors. Actually, today there's a lot of pressure there. We're just under a relentless sense of just patient after patient. You know, the first wave we had the adrenaline, the energy. Now we're dealing with, I think particularly, I mean, you know this as a senior sister, like there's a lot of staff sickness, particularly on the nursing front at the moment.
And that's having a big impact. So in the first wave we didn't really have that, did we? The second wave, we are having staff off sick. So this is causing a problem. And equally, we've got, all our areas have got high acuity. So not only in the resus rooms, when we have high capacity areas, these patients spill out to our majors areas as well. So that's a problem.
So we've got because really our resus patients are the sickest patients in the hospital. Really, they are the ones that end up in intensive care a lot of the time. Not always, but a lot of the time. Yeah. And when those patients are spilling out into majors, what that means is you're having so much of your capacity is full of really sick people. That is what's really tough. Is the patients we're looking after, they need so much care and attention. Yeah. And
you need a decent nurse-patient ratio as well when you've got these unwell patients. And
skilled nurses as well, because it isn't easy.
And when you've got these patients waiting for ITU, we've got long waits of getting our patients to ITU, so they're staying within our resus areas for a long time. Then we get more and more blue lights, and the department just becomes under pressure. We also get a lot of patients that are walking in extremely unwell, that are going straight into the resus areas.
It's hard. It's an emotional toll. Like I said to you guys before, it is hard because, you know, I think there's a misconception as well that all the patients we're seeing are elderly. We've seen a lot of young people, haven't we?
Yes.
Really, we have. If we're honest, I mean, yes. If you look at the statistics, the elderly, the 80 plus, you know, is where a lot of mortality is. We know that. Yeah. But we are seeing a lot of patients that are young, that are getting intensive care, 40, 50, 60-year-olds. You know, I've seen someone in the middle ages today in my shift. They're going into intensive care. Yeah. You know, it's tough because a lot of people will catch it and have very mild illness, but there's no guarantee of that. No, you could well have a serious illness, and you know, people talk about risk factors. A lot of people don't have any risk factors.
Yeah. And a lot of, we're noticing that people deteriorate very quickly. So they will come into our resus room or majors area and they are unwell, but they become very unwell very quickly. Yeah. And we try our best and our hardest to get them the emergency treatment that they need to get. Yeah. Absolutely. So if you do feel unwell, you need to, and you are struggling, don't leave it. We are here for you. We are here for the Lewisham community.
I don't want people not coming in. Like I've always said this before. If you're unwell, if you're really breathless, if you're struggling, if you're concerned and you're worried, I'd rather you pick the phone, call 111, and if you're really feeling sick, then just come here to A&E. We want to look after people. We don't want people coming here when they've waited so long. And that goes for non-COVID issues as well. I don't want to scare people. You know, I'm always very positive on my channel, positive on YouTube, positive on Instagram, but I think it's very important to be honest for people, isn't it?
And also we do have to remember, we do see the sharp end.
Of course we do. There's a huge proportion that aren't having problems. They self-isolate at home, they have a mild illness and they're fine, but I just want to get that message across because, you know, it really frustrates me. Some people online, you see them going into hospitals, they take pictures of empty corridors or waiting rooms, and the reason the waiting rooms are empty is because a lot of outpatient services and things are being shut because the pressures are so much on the acute service that the pooling of staff has been into the wards, into the areas and A&E to support things. That's why it's empty, because everyone's pulled into the areas where everyone's sick. So I can assure you, and as staff that have been here for a long time, it's the worst I've seen it.
Yes, and I would like to highlight actually our team is so pulling together. Our teamwork is great. We are a family here, aren't we?
Yeah, we are. I know we joke about the bath bombs, but those things around self-care, you know, I know that, you know, your Gail's, who's very well, doing a great job of holding the camera as well, you know, just buying each other a coffee or having you know, giving each other little gifts, or, you know, chocolates, or, you know, just, you know, if you're having a tough day, bring some a Diet Coke or whatever, those kind of things.
It's just the little things, isn't it? Yeah. But also, you know, there is a big emotional impact for us as well to see. Pre-COVID, you would see a very unwell patient, there would be a few trickling in. But it is hard watching our patients so unwell. Yeah, it's hard. It's day after day, you know, to see patients so unwell, so quickly, deteriorate. And it's hard on us emotionally, isn't it? And yesterday I looked after a patient in our blue resus area and we turned them around and it was so lovely to see.
It's such a good feeling,
So we have a non-invasive ventilation, had them on
tight fitting mask that blows air to give pressure for the lungs,
and he was on it for 4 hours and he didn't look well when he came in. And then 4 hours later we took the mask off. And I was there chatting with him, and it was just amazing to see. He didn't go to ITU. Yeah. He went to a normal ward. Yeah.
So there are obviously hear the stories that are really sad, but there's a lot of real positive stuff going on that we're doing around.
And it really uplifts you. Like it uplifted me to look after this man.
It does. So there's a lot of good stuff going on. Amanda, thank you so much for your time, and Gail for being a fantastic camera woman and a brilliant sister as well. all the nurses, doctors, everyone at home, everyone in the community doing a bit, the amazing people who are staying at home, helping, those that are doing, you know, acts of kindness, support people, thank you so much. Lots of love. I hope this has been a useful video. Don't forget to hit subscribe on the channel if you've enjoyed the video, like, comment, share, do all the usual bits and pieces, and yeah, just a huge thank you from me. And don't forget to check out those Lifebuoy wipes as well for the foam. They do work, very handy. Take care and goodbye.